Red wine is frequently consumed at cocktail parties, movie nights, and the dinner table. Like with any type of alcohol, some people drink red wine moderately, some drink in excess, and some rarely drink it at all. Red wine and its supposed health benefits have been a popular topic of discussion in the news.
But today we're going to concentrate on the health benefits to the cardiovascular system. Okay. We're talking about red wine. Red wine contains, and the theme here is going to be something called a polyphenol. You'll have all heard of resveratrol, right? That's a plant-based antioxidant.
Yeah. Okay.
It's an antioxidant. So what does that mean? It means that it promotes cardiovascular health. It stabilizes the arteries. Good for you. Raises HDL.
And wine
lowers
has
LDL. And wine has it, especially red wine.
We decided to investigate the validity of these claims. According to Dr. Klatsky, who has been the principal investigator of a series of studies on the relations between drinking alcoholic beverages and health, the main medical benefit of reasonable alcohol use seems to be a lowering of the risk for coronary heart disease, which results from the buildup of atherosclerosis, or fatty plaque, in the arteries that feed blood to the heart. Atherosclerosis restricts blood flow to the heart and can promote the formation of blood vessel blocking clots. It can thereby cause angina, which is chest discomfort resulting from low oxygen levels in the heart muscles. Atherosclerosis can also cause heart attacks or the death of heart tissue that occurs when the narrowing of the arteries prevents blood from reaching the heart. Heart attacks may also result in death, often without warning. Cardiovascular disease, or CVD, is the #1 leading cause of death in the United States, resulting in 610,000 deaths every year. So, if consuming red wine in moderate amounts could decrease the number of deaths, this could dramatically impact thousands of lives. The American Heart Association recommends moderate drinking. This means 2 standard servings of alcohol a day for men and 1 standard serving of alcohol a day for women. A standard serving of wine is 5 ounces. According to a report by the American Heart Association, the prevalence of CVD, which is comprised of coronary heart disease, heart failure, stroke, and hypertension in adults over 20 years of age, is 48% overall and increases with advancing age in both males and females. In 2010, roughly $444 billion was spent on CVD treatment.
So, what makes wine good for you? A standard glass of wine contains about 88 milligrams of flavonoids, or plant-based antioxidants. Flavonoids reduce the risk of atherosclerosis by preventing the coagulation of blood cells. In a study published by the National Center for Biotechnology Information, researchers say individuals who consume moderate amounts of wine experience 20 to 30% reductions in all causes of mortality, particularly cardiovascular mortality, an effect known to be associated with flavonoid composition of red wine. However, there is debate in the scientific community about how effective red wine consumption is in preventing cardiovascular disease. Red wine is a part of the Mediterranean diet, which also includes consumption of plant-based foods, olive oils, herbs, fish, and very limited red meat. It also recommends exercise and having meals with family and friends. Altogether, it is proven that the risk of developing CVD decreases as LDL levels decrease, therefore lowering the amount of cholesterol in the arteries. In all, until more research comes out pertaining to red wine consumption specifically, it is recommended to consume a well-balanced diet consisting of the main food groups. Drinking alcohol of any kind, including red wine, is acceptable when done in moderation. Overconsumption or underconsumption of anything is detrimental for one's diet.
What we do know, says David Katz, is that drinking habitually, but moderately, is part of the Mediterranean diet and linked to a long life. Just ask cardiologist James O'Keefe, who loves red wine for its ability to lower the risk of coronary artery disease, diabetes, congestive heart failure, and stroke.
So the next time you question whether or not you should open that bottle of red wine while having dinner, go for it if you want. But if you do, make sure to follow the American Heart Association's recommended guideline: 1 glass a day for women and 2 glasses a day for men.